All right, so you came here tonight to hear a little bit about how to manage your health and use holistic approaches to manage health. And I certainly can't cover every single ailment in an hour and 15 minutes, or however much time we have together. So I'm going to kind of hit on some of the chronic conditions that we face as a country, that many of us either have or know someone that has, and just share some science with you behind some of the research that's been done that can lead to better outcomes when you incorporate holistic approaches to health. So as was mentioned, I'm a nurse, so you're going to hear a nurse's perspective, not a NP's perspective. I'm a registered nurse with a master's in nursing from U of D, and I'm board certified in advanced holistic nursing. And as was mentioned, a member of my professional organization, which is the American Holistic Nursing Association. I've been with Ascension for almost 30 years, and at Ascension Providence Rochester for the last 2 years. And my role there is in quality, and I oversee the infection prevention department there. Okay, so I'm giving you all my disclosures. So I have an LLC that I developed called C Wellness, in which I see clients privately to help manage their health and reach their wellness goals. So I'm not a therapist. They're not with me for months and months and months. We work together to establish goals, and we do a kind of comprehensive self-care assessment, looking at mind, body, and spirit. And then I'm also an Arbonne independent consultant. And this isn't going to be a sales pitch tonight for Arbonne. I do have some cards in the back and some information on some of the products that I'm just going to talk about at a high level. There's other companies out there. Again, I'm not selling you on Arbonne, but I have to disclose to you that I am an Arbonne consultant. Okay. All right, so this, I don't know if you can read this in the back. This just tells you a little bit about who I am. And as I said, I've been a nurse for over 30 years, and I work in quality at Rochester. And these are just some of the things. I don't know if this is, yeah, it does have a pointer, great. So I have a passion and a vision for educating others, because I believe that if you're armed with information, right, knowledge is power. So extremely important. So I'm just delighted that there's so many people here tonight. I thought there would be like 20 people. I'm like, wow. So and I think Stephanie, who coordinated this tonight, she was a little nervous. She's like, how big is the biggest group that you've spoken to? I said, between 50 and 100. She's like, okay. And I could see her shoulders come down because she was like making sure. So thank you, Stephanie, for organizing. And the other person I have to recognize real quickly, and he didn't know I was going to do this, is my significant other, who's sitting in the back row, Paul Greening, who came all the way out here to support me tonight. So say hi, Paul. Raise your hand. He's like over 6 foot, so he always sits in the back. Okay, so I developed the LLC because I know that there's a need to help people, to support people along their wellness journey. And then some of this stuff I'm going to talk about as we go through the presentation. So what is holistic nursing? And I think you hear a lot of different terms: integrative health, holistic, alternative therapies, CAM. We're going to just kind of, some of you may already know what those mean, but it's important to kind of set some foundations. So holistic nursing is defined as all nursing practice that has healing the whole person as its goal. And if you're familiar with Ascension, you know that that's part of our mission, to provide spiritually centered holistic care. So the only reason I put this up here is so that you can understand and maybe hear the difference. There's critical care nursing, there's med-surg nursing, there's obstetrics, there's trauma, there's pediatrics, there's, I already said obstetrics. So holistic nursing is its own discipline. Whoops. Sorry about that. It's its own discipline, and it's a specialty that focuses on caring for the whole person, mind, body, and spirit, right? And it looks at the environment, emotion, the social relationship, and the whole person being, which could be the patient, a coworker, a family or friend. I feel like this isn't even on, but you're saying you can hear me. Okay, all right. So that being said, what does it mean? So this is just a little walk down kind of history here. How many of you have heard of Florence Nightingale? Okay, yeah. All right. So she was considered to be actually the founder of holistic nursing. And she taught nurses to focus on principles of holism, unity, wellness, and the interrelationship of human beings and their environment. So during the Crimean War, she would go to where the injured soldiers were, and she would create an environment that would have some fresh air, that would have some artwork for them to look at, because that created an environment of healing, right? So I said to Stephanie when I came in here tonight, I said, oh, I wish I would have remembered my music, you know, and had my speaker and just had some kind of calming music to playing, because what does that do? It creates an environment, right? When you go to the spa, if you ever go to the spa, it feels very different than when you go to the mall, right? Or when you're trying to find a parking spot at Somerset during the holidays, right? It feels very different. So this is important for healing, for no matter what you have to heal from, because we all have something to heal from, whether it's emotional or physical or spiritual. Creating an environment is extremely important, not just taking the medication or doing the modality. We want to make sure that we are creating an environment that is conducive to healing, okay? So it's not something that we just do. It's an attitude or philosophy, and it's a way of being that requires us to integrate self-care, self-responsibility, spirituality, and reflection in their lives. So this talks about how it's so important as caregivers, right? Because you can substitute that word nurse for caregiver. How many of you in this room are a caregiver in your daily life or in your routine? So many of you, right? So this is really important. What this is saying is that if you can't and you don't take care of yourself first and foremost, and fuel your own vessel, making sure that you're getting enough sleep, that you're eating right, that you have some sort of spiritual practice, whatever that is, that it becomes very difficult for you to then care for others, right, if your own vessel is empty. That's really the takeaway here. So the National Institute of Health did a survey in 2012 and found that more than 30% of adults in the United States and 12% of children use non-conventional healthcare approaches that have origins outside of usual Western practice. Okay, and we're going to talk about some of those tonight. If a non-mainstream practice is used together with conventional medicine, it's considered complementary. So did you know that? Did you know that that's what complementary means? Okay, good. And if it's a non-mainstream practice is used in place of conventional medicine, it's considered alternative. Okay? So most people who use non-mainstream approaches also use conventional healthcare. And you will see at the bottom of a lot of my slides, I've put a resource or a source there for you. So if you're taking notes, you can delve further into some of this content. So here are the definitions. Functional medicine is an approach that more closely resembles naturopathy, a medical system that has evolved from a combination of traditional practices and healthcare approaches popular in Europe during the 19th century. So you can go and see an ND, a naturopathic doctor, right, that has training from either Bastyr or I can't remember the other one, but they are trained in functional medicine. Then there's integrative health, which brings conventional and complementary approaches together in a coordinated way, okay? So you can have integrative health physicians, you can have MDs and DOs that do a fellowship in integrative health, okay? And then CAM, complementary and alternative medicine together, All right, so these are the definitions. So when we throw these terms out or you hear your provider throwing them out, it's important to understand the difference. So holism is a Greek word meaning all, whole, entire, or total, and holistic medicine deals with a human being as a whole. So, you know, how often do you go to your primary care physician with an ailment of whatever, pick one, depression, anxiety, whatever, and what do? Do we treat the cause in a traditional medical model, or we treat the symptoms, right? That's what we do. Okay. So there's a place for both. Okay. This isn't a talk on replacing conventional medicine. That's not what this is about. This is about what can we do in addition to help us lead healthier lives. So there are 5 distinct domains for CAM. There's manipulative and body-based methods and biological treatments, mind-body interventions, energy therapies, and alternative medical systems. So what does that mean? So there's examples of all of this. So what would be, for example, a manipulative and body-based kind of approach to health? Chiropractic, massage, good. What would be like a biological treatment, do you think? So yell them out, because you don't have mics, I can't hear you. What would be a biological treatment, do you think? So maybe like aromatherapy, essential oils, right? Sure, yeah, absolutely. Herbalist, if you didn't hear, herbalist is also a biological treatment. Okay, mind-body interventions. What did I have you do when you first sat down? Yeah. So and some people don't like that word, right? So it's practicing mindfulness, right? Being more present so that you can have richer relationships with yourself, with God, and with others, right? So practicing any type of mindfulness activity or having that incorporated into your daily practice. It could be prayer, right? So again, time alone with just you, with your own thoughts and feelings. So evidence from national studies suggests that approximately 1/3 of Americans use some sort of CAM in the past 12 months, okay? In 2007, because this is the latest published number that I could find, Americans spent nearly $34 billion, billion, B with a B, in out-of-pocket expenses on CAM, which represented a 25% increase from 1997. Okay, so what is that telling you? It's a pretty smart group. What is that telling you? Yeah, it's smart, it works, and we're hungry for it, and we need to get our insurance companies to catch up, right? Because, and I'll give myself as an example. So I went to the ophthalmologist for my little sty problem a few days ago. And back in the old days, they would just like give you an antibiotic, right? Or an antibiotic cream, or inject it, lance it. So none of those really sounded wonderful to me because I don't want to go on an oral antibiotic because it's going to kill my gut flora. And it really wasn't an infection. He felt like it wasn't a cellulitis. It's just whatever it is, right? They never know the cause. So he said, well, we've got this new thing, and it's a heated light thing, and I can just, not like a laser, but kind of similar, but non-invasive, right? And I've been a nurse for a long time, and I hate needles. I can dish it out, but I can't take it. So I'm just full disclosure. So he did the procedure, but guess what? It's not covered by insurance. So he's like, it's $200, but you're an employee. We'll give you a little bit off. I'm like, oh my God. So, but, and I still have it. So I said, how much longer? He said, probably 2 weeks. So again, it's not covered. We pay for this because we want less invasive things. We don't want to have to take a pill for every single thing if we don't have to. Or maybe we can take less of that medication if it's appropriate. Okay? So what does healthy mean to you? And if we just ponder that for a minute, this is very, very individual. It's emotionally charged for people, because if you were raised in a household, well, you know what? After 60, we're just done, or we didn't have a really good role model for self-care growing up, right? Because especially, nothing against the gentlemen in the room, but especially females, we are used to being the nurturers, right? The caregivers, and we take care of everybody else and ourselves last, right? Yes? So being, practicing self-care, and you're going to hear me repeat myself throughout this hour, is really about an exercise in self-love, okay? So what does healthy mean to you? Does it mean that you're going to be free of disease? Does it mean that, you know what, I led a good life, I'm about to retire, and, that's when all my problems are going to start, and that's just what happened with my father and my grandfather and his father, and that's just the way it is, right? There are beliefs that we carry with us about health, okay? My mother is 80-something, whatever she is, and she's been a widow for a very long time. My dad died when I was in nursing school. I'm the oldest of 3 girls, and she has osteoporosis, and she had to have a knee replacement a few years back, and she did very well, and she's overall in pretty good health. But she has a mindset, well, I can't do that because I have this bone issue, or I can't do this, or I can't do that, or whatever. So we kind of set ourselves up too, mindfully. We set ourselves up sometimes for failure. And we don't even know that we're doing that, because she's absolutely fine and she can go up and down stairs and all that kind of thing. But that plays a role in our health. You need to pay attention to your emotions, because our emotions carry energy, and our emotions are the foundation for our health. That is our wheelhouse, okay? So what does health mean to you? Acute, chronic, free of dis-ease, maybe not sleep deprived, maybe your stress is managed, weight controlled. You can read these. And the one I circled is free of an inflammatory process. And what causes inflammation, do you think, in our bodies? Stress, and more stress, and sugar. And what else? Chocolate. Yeah. So everything in moderation, right? But what else causes inflammation? Chemicals, yes. So where do we find chemicals? Food, the air, right. So if we can reduce that load, right? So maybe eat fewer processed foods. Yes? Right. So I'm not a nutrition expert, and I would I know enough to be dangerous, but I am definitely not a registered dietitian. I will tell you that the first thing they will tell you is less words, better for you. Okay? So an apple versus a frozen dinner, right? Okay, so we have, what has happened in our country as far as obesity? Rates up or down in the last 10 years? Up. Okay, what's happened with anxiety? Up or down in the last 10 years? Up. What's happened with chronic disease in this country? MS, up. Okay, so we are what we eat. All right. As much as we like, and I like a really good bottle of red wine. Ask Paul. But again, it's in moderation, right? If I drank a bottle every night, right, I might have an issue, right? Okay. So alcohol does cause inflammation in the body. Okay. All right. So here are some of the conditions that I've already talked about: anxiety, stress, migraines, and you can see the list. These are kind of my top few that I wanted to just maybe touch on with you and give you some tools in your toolkit to help manage some of these things. So if you had a burning question or a topic that you had hoped that you would hear about tonight and that I haven't covered, please, raise your hand in the next 15 minutes so that I can address it, okay? Because I want you to go away feeling like you got what you came here for. Okay, so the human energy field, I've kind of interspersed some different things in here because I think it's important to understand this. So if you walked in here tonight and nobody greeted you and nobody smiled at you, and the temperature in the room was really, really cold, and we didn't get the technical issues figured out, how would you feel? Louder for me. Disappointed, yeah. Okay, kind of frustrated, maybe pissed off, if I can say that in this group. Okay, so irritated, annoyed, right? These are all, what kinds of emotions are these? Negative emotions. So when you walk into a room and someone greets you and says, "Hey, I'm so glad you came. Thanks for coming." How does that make you feel? Good, right? You walk up into a nursing unit at the hospital and people don't greet you with a smile, right? Don't say hello. How can I help you? Clearly you don't work there or belong there. I go all over the hospital in my role, and I can feel very different, right, from one department to the next. And hopefully everybody is going to greet me, right, with a smile and be willing to help. That's what this slide is talking about, that we all carry with us an energy, right? And when we're depleted, right, when we're tired, when we're not nourished, what kind of people are we? Crabby, yeah. Crabby and irritable, and as my partner would say, hangry. We're hangry, okay? So we need to eat, we need to take care of ourselves, because what you give, you get back, right? So everything is energy, and we carry with us an energy field, and we are all connected, okay? All right, that's an hour talk all by itself, so that's just kind of what I want to talk about. Okay. So, holistic approaches to health. So this is an old Sanskrit word called chakra, pronounced chakra, S-H-O, and it means wheels of light. And we have these different chakras in the body, okay, that are energy centers. And there's 7 major ones, and they actually coincide with how many of you have heard of Maslow's hierarchy of needs? Yeah, okay. So that's kind of, they coincide with that. So our first chakra here is the grounding and the security and how we feel safe. That's like right here, right? That's our like foundation, And if this is messed up, right? If the physiological stuff is messed up, then we can't get on to feeling safe. We need to feel safe, right? We need to feel safe wherever we are, right? It is a human need, okay? So we have, as I said, 7 different chakras. And again, depending on what your beliefs are, you don't even have to know anything about the chakras. You just have to know that you got to have these needs met. And if they're not, if something's out of balance, right, then we're not so healthy, right? We got to get ourselves back into balance. So here we talk a little bit about presence of science and touch. I'm sorry that this isn't flowing as I would have liked, but I interjected this and put this slide here because I didn't want to forget to talk about it. So being in close proximity to each other and having human touch is extremely important for our health. Okay, there are some people in the elderly population that are living very isolated lives and don't have the human touch. Okay, as a nurse, I'm a touchy-feely person, so I will do this, and I will just involuntarily do it. I won't even ask for permission, and sometimes that's not so good. I get myself in trouble. So just knowing that there is science behind that is really why I put this here. That this isn't just a juju thing, you know. There is real science behind it, and there's research behind it. That we need that as human beings. We are social beings. And this endorphin that we talk about that's kind of released, this is a hormone that's released when someone does touch you and does look at you and smile and comes really close to you, right? Because now our energy fields are kind of interspersed here together, right? Oh, our energy fields are interspersed. I'm going to come and stand right by you for that. Thank you. You have that colorful shirt on. I've been admiring it all evening. It's just wonderful. Okay, this is going to work. Okay, so what does this look like? It's like a beautiful day in Michigan, not right now, but yeah, beautiful, right? So how does that make you feel when you look at that? Good. Does it make you feel good? Okay, so peaceful, right? And you have to remember, too, that for some, this could also be signify maybe a painful memory, right? So that happens too. It could trigger a memory of maybe something that happened that wasn't so good. So again, when you put things up in your home, right, on the wall, you put artwork in there, or you're caring for someone that isn't feeling well, it's important to have things around you that make you feel good. Right, that you can look at, even in silence, even if you're by yourself, okay? Really important. You can see there's just nice bright light, the water's calm. Water always calms me, you know, I like being close to the water. The bridge, what could the bridge potentially signify for you? Connection. Right, connection, next steps, walking forward, moving forward. We're looking at a new year, right? Looking ahead, not looking back. Okay, so now we're going to get into a little bit about some of the approaches and some of the problems that we continue to face in this country because we don't deal with cause and we don't deal with the problem. So the American Medical Association recognizes obesity as a chronic disease. Adult obesity rates now exceed 35% in 5 states, 30% in 25 states, and 25% in 46 states. Okay, and this was taken from the CDC website on January 2018. This is pretty recent info I'm sharing with you. About 1 in 13 adults and 1 in 13 were considered to have extreme obesity. What are we doing to ourselves, right? What are we doing to our nation? What are we doing for our young people? About 1 in 6 children and adolescents aged 2 to 19 were considered to have obesity. That is staggering. That got my attention. This, yeah, got my attention, but this really got my attention. So what's the price? What's the price we pay? The estimated annual medical cost of obesity in 2008 was $147 billion. Among all payers, obese persons had estimated medical costs that were $1,429 higher than persons of normal weight. Obesity increases the risk of additional diseases, as you know, right? Joint issues, hypertension, diabetes, gallstones, cancer, fatty liver, and sleep apnea. 1 in 5 deaths are associated with obesity, okay? And for patients with a BMI greater than 40, life expectancy is significantly reduced. I'm sharing this with you because it's important for us to understand the problem before we can start addressing with solutions. So it's a complex problem. It's not a one-off. It's not check the box and we'll fix obesity. That's not what it is. We have genetics that can control appetite and metabolism, and you can't change genetics, right? Genetics are fixed. You can change lifestyle, but you can't change genetics. Calories in versus calories out. The difference in obesity prevalence between populations result primarily from differences in energy intake rather than expenditure. That was published in Human Obesity in July of 2012. Quality versus quantity of food, right? Because when we go out to eat, we split an entree because there's no way I can finish an entire meal with a salad and a soup and an entree, right? So we got to look at quantity versus the quantity of what we're eating. Quality. Microbiome and environmental toxicity. So what's the microbiome? What is that? Do you know what that is? That's the gut, right? That's the gut. And we're now, I was just at a conference at Scripps Health out in San Diego last February, and the focus, it was a supplements conference put on by a number of physicians, and the research now coming out from the microbiome is saying that we even have the ability now to change the genetics of our microbiome just by what we eat. And through meditation and lifestyle changes, we can actually do that. And the research is preliminary, but it was very impressive. So looking at the environment and looking at the level of toxicity in our own environments, using aerosols, for example. Medications, the number of medications that we use to combat these chronic diseases, and how did we get to have such a problem with diabetes in this country? It's through our food. Some of it is well within our control. Endocrine disorders and psychological factors. All of these factors contribute to obesity. That's why it's a complex problem. That's why you can't go to your primary care physician and have them tell you that you need to lose 10 pounds, or you need to lose weight. And then what do? They send you out the door, right? Do they give you a plan? A detailed plan for how you're going to get there? No. Okay. So lifestyle medicine for the treatment of obesity. So I am a huge proponent of this. That's why I do sell Arbonne, because their products are pure, safe, and beneficial, and they contribute and help people along their journey. There's others out there too. I promised you it wasn't going to give you a sales pitch. So lifestyle medicine is the therapeutic use of evidence-based lifestyle interventions to treat and prevent lifestyle-related diseases in a clinical setting. It empowers individuals with knowledge and life skills to make effective behavior changes that address the underlying causes, okay, of disease. And obesity is a disease, okay? Okay. So the American College of Preventive Medicine releases Lifestyle Medicine Literature Review. This was back in 2009. I pulled this because it's important for you to see the difference. And I've highlighted what's the difference between conventional and lifestyle. And how many of you have received a script for lifestyle changes, whether it was related to obesity or some other problem that you landed in your physician's office? No, because they're not equipped, they're not trained. This is not a criticism of our medical model and our physicians. I work with them every day. I have for 30 years. Okay, it's not a criticism. What it is they're not equipped to do that. They don't have the time in their offices, most of them, and they don't have training in this, okay? So look at how it feels. Conventional treats individual risk factors. Lifestyle treats the lifestyle cause. So what is it that you're doing, right? Or not doing that's contributing to your anxiety, your depression, your obesity? Pick one. You can, plug it in there, okay? Patient often passive role, not required to make big changes in conventional medicine, right? In the lifestyle model, patients plays an active role and they're required to make big changes and then be held accountable, right? So how do you do that? You do that with either a coach, that's what I do in my practice. So again, you can read this. Responsibility falls on the clinician in conventional. Here it falls on the patient. It's about holding yourself accountable and taking a more active role to manage your health. The goal here in conventional is that it's disease management, and in lifestyle behavior modification, it's in prevention. It's in disease prevention. Okay, using lifestyle medicine in the United States healthcare to treat obesity. How many of you know someone that's had bariatric surgery? 2/3 of this room, okay? Lifestyle behavior change is essential to success for both surgical and non-surgical weight loss, as over 50% of bariatric surgery patients regain weight without lifestyle modification. Look it up. This is where it was published in 2015. This is my source. Okay, that's staggering. Think about that, 50%. Okay, new developments in diet, physical activity, and behavior therapy. A comprehensive program of lifestyle modification produces a 7 to 10% reduction in initial weight that is associated with clinically meaningful improvements in several cardiovascular disease risk factors, including the prevention of type 2 diabetes. Just take baby steps. Maybe it's reducing red meat in the diet. You know, not eliminating it. I'm not a vegetarian. I'm not advocating for that. Although the research shows that more plant-based in our diet tends to help us with hypertension, with weight loss, with weight gain, etc. Okay, so important to highlight those. Long-term effects of a lifestyle intervention on weight and cardiovascular risk factors in individuals with type 2 diabetes. There's a 4-year results of the Look Ahead trial, and this was published in the Internal Medicine Archives of Internal Medicine Journal, a very well-respected MD physician journal. Although the greatest benefits were often seen at 1 year, the intensive lifestyle intervention participants still had greater improvements than diabetes support and education. Participants in weight, fitness, and hemoglobin A1C, blood pressure, and HDL-C at 4 years. So the evidence is there. We have to take control of our own health. We have to start making these lifestyle modifications a little bit at a time, and they'll go a long way. So what are the patient and practitioner challenges? Well, it's hard. It's not easy, right? Or we wouldn't have this problem, okay? So the statistics show that most patients who lose weight regain the weight within 5 years. Obesity has no short-term fix, and the research shows the body prompts us to eat about 100 calories more than usual for every 2 pounds or so of weight lost, okay? So my role is to arm you with the information, right, so that you can make better decisions when you leave here. Doctors inform their patients they are obese but offer few solutions, as I mentioned. One of the biggest issues is that there's so much need by patients, and there is so little that doctors have to offer right now because of the lack of training and time. And that was published in the U.S. News in December of 2017. Okay? So disease management and the organization of the physician's practice. They lack time, they lack information technology and financial incentives, right? They're going to get paid for the office visit and for writing you a prescription because that's easier and that's how they're going to get reimbursed. There's a large gap between what physicians do for patients with chronic diseases and what should be done. And that was published in JAMA back in 2005. And JAMA is the journal of, thank you. Thank you. It's been a 14-hour day for me. So, okay. So, which is a very, again, well-respected journal, right, for physicians. Okay. A solution for practitioners treating patients with obesity. Well, fiber. So if you walk away with nothing else tonight, walk away with that. That you're probably 90% of you in this room are not getting the fiber that you need in your diet. And that is not a secret. I think everybody's probably heard that at one time or another, okay? This is what the average American consumes, and we need a lot more, right? Because what's happened to our colon cancer statistics in the last 10 years? Up. Do you think that might have something to do with diet? Do you believe that? Okay. Again, the research is there to support it. You are what you eat, okay? Fiber, digestion, you need to cleanse, you need to use supplements because we can't possibly consume from the food we eat enough fiber in the day, okay? So you have to supplement, okay? Manage your caffeine and alcohol and do an inventory assessment with a trained professional. Somebody that knows what they're doing. Ask what the qualifications are. If you came to see me, I would want you to ask me, what makes you qualified to help me? Okay? Don't be afraid to ask those questions of whoever you are reaching out to. Okay. So how to change things when change is hard, okay? Well, educate, which you come to these Smart Town sessions, so you're getting yourself educated. Be clear about what it is that you are seeking, okay? Motivate, have confidence, and then have a plan. And this was published out of Switch, How to Change Things. This came out of Heath and Heath study in 2011. What do you think this means? So I see some puzzled looks. What do you think that means? You do. Yes, I do. Okay. Great question. Did everybody hear the question? Okay, so I'm going to repeat the question. Are we moving in this direction, and are there more, where is healthcare going? Because this is saying to her, and I'm sorry, what's your first name? Mary, is saying that this slide is telling her that we need to take more responsibility ourselves for our own health. And is it possible that in the way our healthcare system is now that we can get this? Or do we have to go outside and pay out of pocket to go to get these services? And I will tell you that healthcare is not moving fast enough. So that's why I have an LLC. I mean, I'm being really honest with you. There's no place for people to go unless you're going to pay out of pocket to do that. Are we slowly, gradually moving in that direction? Yes, but we're not there, and I don't know that we're going to be there in my lifetime. So this until insurance companies will pay for prevention, truly pay for prevention, because the sicker you are, the more we get paid. It's just the way it is, you know? And so it's a sick care system, not a health system. So, and you've probably heard people say that before. So I would say that, I don't want to sound all doom and gloom, but we're just not there yet. I mean, I've worked in healthcare for a long time, and we just are not there yet. If I wanted to go see a naturopathic doctor or an integrative health doctor, which I did, that is all out of pocket for me. Okay, and I'm self-supporting, right? We're not married yet. We haven't got hitched yet, so he's making me pay for everything myself. No, I'm just kidding. I'm kidding. I'm kidding. Pardon? That's what you got to blame on somebody else. So, and we're really good at that. So, what else? Who else has any other thoughts about this slide? What is it saying to you? Yes.
I just wanted to say my daughter lives in California, and they are starting to cover holistic care.
That's wonderful. My sister lives in San Diego too. She did in healthcare. Yeah. It will. It tends to start out there. Everything starts out there and then starts to move this way. I don't know why. I don't either. So thank you. So there is a light at the end of the tunnel here. Was there another hand I saw? Yes. How do we close the gap? I wish I knew. That would be, if I knew, I think I'd be able to retire. Yeah. So I think the more we give people a voice, around this, around prevention, around integrative health, around holistic approaches to health. The more that we question and write our Congress people to start changing healthcare, and I don't know where you are in terms of Obamacare, but it really didn't do what it needed to do. And it's a true disappointment. And as a nurse and as somebody that sees patients every day, it didn't do what it needed to do. And so, and I don't know if I shared this with you. I was born and raised in I was born in Toronto and I was raised in Windsor. And I've lived here in Michigan since 1990, and I came over legally. I have a dual citizenship now, and my two younger sisters both also married Americans, and they live here. And we just moved my mom here about 7 years ago. Again, all through the legal process and the right way, and did all the right things. So we're all glad to be here, but we've got problems we got to fix, right? We've got problems we've got to fix. So studies show that nutrition and lifestyle counseling are important to patient care. However, few physicians offer it within their practice. So, if we can get to our providers and try to have these kind of conversations where they can be more innovative in terms of the services that they provide, and the comprehensive services that they can provide, all the better. Okay, and this also was published out of JAMA in 2017. Okay, so what choices can I make to support my health? Okay, really. So again, this is just going to be a brief commercial for Arbonne. The products are pure, safe, and beneficial. I'm going to tell you there are no preservatives in the products. There are other companies out there that offer. Look for those things. Look for those things to support your health. And as I mentioned earlier, the one thing I will tell you is to increase fiber in your diet. I don't mean products like Metamucil that have other things in them, okay? For example, if you use the Arbonne fiber, it's colorless, it's odorless, it has no artificial sweeteners, preservatives, anything in it. There are other companies that make fiber. Okay, I'm just familiar with this one, and I love it, and I have given it to many clients with great success. So just know that. Okay, this company's been around for 30 plus years. It's based out of Sweden. Their products are amazing. All right. So, and I have product information on all of these things. If you're interested, at the end, I can hand that out to you. Question? Yes, ma'am. To what? How many know how much fiber you're supposed to have for those of you under 50? How much? 30 grams. 30 grams minimum. Okay? And for men, it's a little bit more. Why is fiber so important? Thank you for bringing the question up. Why is it important for us to take in fiber? Regulates the body. Okay, helps with regularity. What else? Pardon? Cleanses, right? Keeps the gut clean. What else? Keeps you less hungry. So it promotes, a healthy weight, right? What else? The gut. What else? It's heart. It's important for your cardiovascular health as well, okay? So it has multiple benefits, all right? Here are some of the modalities in holistic health that you can incorporate to help manage your health. Even if you are 100% healthy, you don't have any chronic illness, you don't have any medications that you take on a daily basis. Aromatherapy, for example, can help with sleep. Okay, so how often? How many of you have taken an over-the-counter sleep aid? How many? Just be honest. Okay. All right. A good majority. Okay. So, and I'm not criticizing that at all. I'm saying try a little lavender, okay? But make sure that you're getting lavender that is real lavender. There's 60 different kinds of lavender, okay, in the essential oil world. So you want to use lavender augustifolia, and you want to put a couple drops on a cotton ball and tuck it in your pillow. okay? Or you can put it in a diffuser, and we'll talk about that in a few minutes. So therapeutic hand massage, music therapy, reflexology, guided imagery, meditation, Reiki, EFT. Emotional freedom technique, you may be familiar with it. It's called tapping, and it's tapping on the meridians to help people with trauma or fears. So I had a fear of flying for a long time, and I got trained. I'm sorry, you can't hear me? That better? Okay. So that's what a emotional freedom technique is, and that is tapping on the meridians and repeating a phrase to work out those fears, okay? And you want to also, if you're interested in that, you want to make sure that you are going to somebody that is trained and qualified in emotional freedom technique, okay? So what are essential oils, okay? They are tiny droplets contained in glands, sacs, or veins of different plant parts, okay? Leaves, stems, bark, flowers, roots, and fruits. Okay, if you go to Bath and Body Works, whatever that store is called in the mall, that is not essential oils, okay? That is not clinical aromatherapy. Many of the products are adulterated, meaning they have chemicals in them, because processing of real, true essential oil is expensive, okay? So they're highly concentrated. They are volatile and flammable, and each EO has about 80 to 300 chemical constituents, okay? So how do we use them? Okay, if you're going to use them clinically, we have a program at the hospital. You have to be trained, because using them in a clinical environment is different than using them in your home, okay? So they can be used for stress, anxiety, all of these different ailments here that you can see. I don't have to read them all to you, but I brought a recipe tonight. I've got a few handouts. I don't know if you want to make more copies, but just for sinus congestion, because this is the time of year. So I have a blend that I use for that, and I will hand that out to you at the end of the talk. So these are the two methods of administration for essential oils, okay? Inhalation and topical. These are the contraindications. So again, you don't want to be using essential oils around people that have respiratory issues, okay? COPD, congestive heart failure, anybody that has any type of airway disease, because and anybody that has cardiovascular disease, you don't want to use. You can use peppermint only. That's the one that causes tachycardia, which is a fast heart rate. Okay, so peppermint has to be used. Peppermint is very good for migraines. Okay, but you don't want to use peppermint for something like this, because what it'll do is it'll exacerbate it. Okay, it'll make it worse. All right. So here's some safety tips if you're using essential oils. How many of you currently use some sort of aromatherapy at home? Okay. How many of you have Febreze in your home? The spray Febreze. Okay. So I would use that with caution. It's very adulterated. It has a lot of chemicals in it, and if anybody's got allergies or asthma, it can send you into full-blown attack. So keep out of reach of children. Keep them away from the light and heat. Do never take them orally. Dilute, dilute, dilute. There is, remember that less is more, and be aware of sensitivities and allergies. So, when I got my training in aromatherapy, there's a dilution ratio, right? You can't just put 2 drops in a diffuser, that's got, let's say, 2 cups of water in it. It's not going to do anything. Okay, so there's dilution ratios, and people that are aromatherapists are trained in that and how to do that. This is around storage, so you want to make sure that if you've opened it up, that that's got an expiration date. They're not good forever. Okay. All right, it is one of the fastest growing therapies in the world, and is defined as the skilled and controlled use of essential oils for physical and emotional health and well-being, okay? And they are, as I mentioned, extracted from plants, and they address root causes without side effects or addictions, used as the first line of defense. So here's an anti-stress blend, okay, if you're taking notes. 7 drops of mandarin, 5 drops of lavender, 3 drops of margarine, and marjoram. And you could put this in an inhaler. You could make your own little inhaler and use this anti-stress blend to inhale. This is an energized blend, 9 drops of rosemary and 6 drops of clary sage. Okay, and this is like years of, dabbling with essential oils and understanding what works and what doesn't. So, you're having kind of a sluggish day, this is a good energized recipe. Okay. Peaceful blend, 8 drops of lavender, 4 drops of ylang ylang, and 3 drops of lemongrass. Okay. So, I got one more. Retreat blend, 10 drops of lavender, 5 drops of lemongrass. So they're not complicated, concoctions or anything, but important for you to understand what goes with what and what mixes with what and what can help support your overall health and manage stress. There's a deep relaxation blend of 8 drops of lavender, 5 drops of marjoram, and 2 drops of mandarin. Because marjoram, you want to make sure that you are ordering it from a reputable company, because there are different kinds of marjoram out there. Yeah. Young Living is a good one. We use Von Buren. I can't think of her first name at the hospital. We use Von Buren. Yes, ma'am. Pardon? Oh, okay. Yep, those are the 2 I would recommend. Yep. And we have, Arbonne also has aromatherapy and they're only making 3 or 4 right now. They're not as comprehensive as a company like the ones I mentioned. Yeah. So Young Living. Yeah. Go ahead. So you can use, for the deep relaxation, you can put this in a every time you use an essential oil, you're using some sort of carrier, okay? So whether it's going into a wick for an inhaler, that's considered a carrier, okay? If you're using it topically, let's say you have, you want to use, let's say eucalyptus, okay? And you want to rub it onto some sore joints. The carrier you're going to use is going to be a jojoba oil, okay? Or some type of cream, like coconut oil that has no scent. But yes, you'll always use a carrier for this. Pardon? Yeah, I don't like olive oil as well, just because of the stability, and it has a flavor, too. It has a scent. Whereas coconut oil, it's not really, it has a lower heat index, is what the word I'm looking for. So grapeseed oil would be better than olive oil, okay? And it's cheaper than using coconut oil. Any other questions about that? Okay. All right. So, mindfulness. What is mindfulness? If you... Dr. Schubner has done a lot of work out of Providence around what mindfulness is, and he's developed a 6-week course that I had the privilege of taking. And so it's about choosing what you're going to pay attention to, he would say, and then with intention, focusing on what it is that you're going to pay attention to and really being present. And then affectionately doing that with love and kindness with yourself and towards others. So that's a nice kind of high-level definition of what mindfulness is. So for us in the hospital setting, and for kind of what we did here at the beginning of our talk, is to just help you get more present, right? Just to be more here, more aware. So it's about being aware of what's going on in the present, moment by moment, without any judgment, okay? There are definitely YouTubes and so on. It says Ascension at the bottom because I developed this curriculum for our nurses to help them sit for board certification in holistic nursing. And this was one of the content areas that I had developed. So there's now you can even download a free app on your phone called Insight Timer. It's INSIGHT Timer. It has thousands and thousands of free meditations, guided meditations. There's YouTubes out there. Again, you can have your own form of whatever that looks like and feels like to you. The important takeaway is to practice it because it's good for your heart health, it's good for your stress management, it's good for your blood pressure, okay? And there's evidence now that supports that. So if you don't have a daily mindfulness practice, again, if nothing else, I would recommend you start that. So what are the benefits? We know that if we experience pain and we go to the doctor because we have pain, or we don't go to the doctor, what's the first thing we do? Take a pill. And we're essentially telling our body to shut up. We don't want to hear about the pain anymore. And instead of just being with it, right, and maybe doing some deep breathing exercises, maybe inhaling a little lavender, maybe just being with it, right? Now, this is not a substitute for, like, if somebody has acute pain in their abdomen and we have to take their appendix out. I'm not telling you to go meditate and wish the pain away. That's not what I'm telling you to do. So, but just be aware of that. Like, just don't be so quick maybe to pop that pill, because we know that reducing pain and it enhances the body's immune system. We also know that the benefits of that it reduces feelings of depression, anxiety, anger, and confusion. Okay, believe it or not, there are times when I get angry at him. Okay, we've been together almost 4 years, and it's not perfect, right? And so if I tend to hold that in and not just kind of calm down and be more mindful and more present, it's not good for me. It's not healthy, right? It's not healthy. So you want to make sure that you have some sort of practice. Again, you don't have to sit like this. I don't sit like this. Okay, I'm usually laying in my bed and I'm comfortable. Make yourself comfortable. It increases the blood flow and slows the heart rate. It provides a sense of calm, peace, and balance. It helps to reverse heart disease. It helps to lower blood sugar. It helps to control thoughts, and it increases energy. And how many diseases do you know of that are caused by stress? And do we ever know the source? And do we treat the source of the stress when we go through the medical model of treatment? No. So this is something free that you can do, and you can start immediately to help. So linking the mind and the body, the thoughts and emotions are interconnected with the physical process of the body. And the stress response, the body produces hormones such as cortisol and neurotransmitters. And I know that's a lot of scientific words up there, but where does cortisol gather in the body when we are stressed? Where do you think it congregates? In the belly. Okay, so when that translates to is more belly fat. The more belly fat we have, the higher risk of heart disease we have. Okay, so when we link the mind or body, we need this fight-flight response, right? So if a bear is about to attack us, we need to know that we need to run away from the bear, right? But when we're stuck in traffic and we're feeling overwhelmed at work and we're worrying about finances, do you think that plays a role on our overall health, that level of stress? Yes. Yes. So let's control what we can control, right? You can't control the other drivers on the road. I'm sorry, as much as you try, you can't do it. I can't control the deer running in front of my car every morning when I come up Avon Road to go to the hospital, right? So you can only control what we can control. How we respond has less to do with the actual event than how we make meaning of that event. Our minds are very powerful. And meditation, mindfulness practice, Prayer will help with that. We are whole beings, right? We can't just focus on the physical, right? We can't ignore that we're made up of, we're whole beings. We have a spiritual side and we have an emotional body, okay? And when all of that's in balance, right, we have health. Now, a mind is like a parachute. Doesn't work if it isn't open, right? Would you agree? Would you agree with that? Okay. Okay. So, how do you use meditation in daily life? Daily breathing, okay? Movement meditation you can do, which is walking. You can do yoga. You can dance, whatever feels good. Just move, okay? The other thing that I didn't tell you is that my herniated disc in my back decided to flare up on New Year's Eve. And so it's better for me to stand and walk and move. I feel better when I'm doing this. But today at work, sitting at my computer for hours, it did not feel good. I was having some significant pain. So the body is meant to heal itself, and the body wants to be moved. It's what we need that for overall health, okay? So other ways of practicing self-care can be journaling. How many of you journal or have ever journaled? Okay, how many of you have no desire whatsoever to journal and that just has no, okay. And I was one of those people, so I appreciate your honesty. And I will just invite you to start with maybe something very simple as a gratitude journal, or just writing down a couple things on a piece of paper before you go to bed, or maybe when you get up in the morning, of what you're thankful for. There are so many that are going with so little, that are functioning, and we have so much. And so I think that we, as humans, because it's human nature, we get focused on all the things that are going wrong in our lives, or the things that we are aspiring to be, or that we want, or whatever. And that can be very powerful. When you energetically write something down on a piece of paper, it has meaning. And that can be letting go of things that have perhaps haunted you, or a relationship that has not gone the way that you've wanted it to go. And journaling can be very powerful that way. And it's not rocket science. There's no right or wrong with it. And even if you did it once a week, it's really helpful for your overall mind health. Okay. Imagery for healing, performance, manifesting your dreams, relaxation, all very important and can be incorporated into a daily mindful practice. So to act mindfully means to remember to enjoy the simple things that we do. Mindfulness, therefore, is to be happy, right? And anybody in this room does not want to be happy? Okay, good. Just checking. Okay. This quickly, because I know I need to wrap up. How many of you have heard of guided imagery? Okay. So this is something, again, too, that can help with managing anxiety before a surgery, before a procedure, before doing anything that is anxiety-provoking for you. And again, it is a kind of a mind over matter thing, but it actually works, and there's science behind this as well. It can reduce stress, it can decrease pain, decrease blood pressure. You can read all of those benefits there. And the research is quite impressive around guided imagery. And we've done this also with nurses that are experiencing burnout, or know that they're going to be coming onto their shift and they're going to be working short-staffed, because I don't know if you're aware, but we are experiencing a significant nursing shortage in this country, and it's not going to get better anytime soon. So they're, working really, really hard with less and less. So they're sleep deprived, they're burnt out, and guided imagery has helped, and we have research to show that now. Okay. Ayurvedic medicine, I'm not going to spend a lot of time on. Know that this is another, again, holistic approach to managing health. You can Google Ayurvedic practitioners. We have them around the state of Michigan. We have them all over the world. This is an old, ancient Indian method of medicine. It's about 5,000 years old. And that's what it means. Life, knowledge, wisdom, or learning. And the purpose is to heal and maintain the quality and longevity of life, not using pharmaceuticals, okay? And there's what we call doshas in Ayurvedic medicine, and there's a quiz that you can take. You can go online on chopracenter.com and do a quiz, and it'll tell you what dosha you are. And it'll tell you what kinds of foods you should eat and what kinds of things you should do and all that kind of stuff. And I didn't know what I was, so I did mine, and I'm a Vata, so it talks about what's good for me that I need to do to stay balanced, what kinds of foods I should stay away from, that kind of thing. But there's real science behind it, and it has worked very well for people if you go to an experienced and reputable practitioner. So finally, what is healing? Okay. I'm going to not ask for a show of hands, but I'm going to guess that everybody in this room has something they need to heal from, whether it's a physical ailment, whether it's an emotional issue, whether it's a relationship issue, whether it's a spiritual discontentment. So this is really where the work begins, is working with self and finding yourself at peace. The only way to do that is to practice mindfulness exercises. I can't give you a prescription or a medication for that. That is that's work that you have to do yourself. And so you've heard me say this probably 100 times during this presentation, that you need to love yourself first, and that all begins with good emotional health, because from there, everything resonates. So thank you so much for your time and your attention.